record at this time, but certainly just let us know if you'd like to. I will now turn it over to Ann Igo. She's our Vice President of Health Systems at SEIU Healthcare to get us started.
Great. Thank you, Neil. Again, my name is Ann Igo. I serve as our Vice President for Hospitals for SEIU Healthcare, Illinois, Indiana, Missouri, and Kansas. Today, we are going to be talking about the actions of Northwestern Memorial Hospital in terms of protecting their workers. Northwestern Memorial Hospital, part of Northwestern Medicine, the wealthiest healthcare system in Illinois. They have continued to call their workers heroes, yet how they're feeling treated and how they are being treated and the actions of Northwestern will tell a very different story. We will hear from workers today that will share their struggles in getting approved for workman's comp, Northwestern actively fighting employees who put in workman's comp claims. We will talk about our hazard pay agreement that the union reached with the employer, only for the employer to turn around and continue to deny hazard pay to those employees who are working the hardest in the hospital. We will hear about stories about downgraded PPE and a struggle to maintain employees' own safety while working day in, day out at Northwestern. The first worker we are going to hear from today is LaGuina Smith. So LaGuina, if you'd like to introduce yourself and your job title at Northwestern.
Hello.
Hi, LaGuina.
Hi.
Hi. So LaGuina, if you'd just like to introduce yourself with your job title.
LaGuina Smith, and I work in environment services.
Okay. And environmental services, if you could just explain for folks, what does your work entail at Northwestern?
I clean labor and delivery recovery rooms and OR rooms.
Okay. And if you just want to share a little bit about your struggle so far with COVID-19 at Northwestern. I understand you have tested positive?
Yes, I was tested positive on March 29th. I took the test on the 27th. After that, I was off work. I was off work like a month. I went back to work April 20th, and April the 28th. No, the weekend of the 28th, my son got sick, and right now he's in ICU due to COVID-19 complications.
Wow, that's incredibly scary. How old is your son?
He's 10 years old.
And so what has that been like for you? First getting sick and then your son getting sick?
A nightmare.
And has Northwestern reached out to you to help, to provide support
No.
during this time?
No.
How have you received pay during this time?
Right now I'm not receiving, I got my last check for this week, but that's because I worked the other week and a half. Mm-hmm. But that was it.
Yeah. So when you were out after you tested positive, in our conversations with Northwestern, between the union and Northwestern, they insisted employees who tested positive would be eligible for workman's comp. Have you found that to be the case?
No.
And what has been your interaction with Northwestern on trying to get workman's comp?
I've been in a circle. It was call the union, call HR, call your manager, call the manager, we don't do that. Honestly, we don't know if you actually contracted COVID-19 in the workforce, in the hospital, basically.
And you're not the only person in your department that has tested positive, correct?
No, correct.
Yeah. So you've had nurses, unit secretaries, PCTs who have all tested positive?
Yes.
Yeah. We've heard this from a lot of Northwestern employees. Northwestern has provided written communication to employees claiming that, we're sorry that you tested positive. However, we've been unable to trace your exposure to a patient or a positive coworker. Has Northwestern formally denied your workman's comp claim?
Well, I never received the claim papers.
So you haven't even got
I
to the
called
point.
in for it, but I haven't received it for
Okay.
for the weeks that I didn't get paid.
Exactly, right. And so to understand the process is an employee fills out an employee incident report, and then it's the responsibility of the employer to file a claim. Do you have faith that your supervisor or Northwestern has filed a workman's comp claim on your behalf yet?
I'm not sure.
Okay. When I started off, I shared that Northwestern has been referring to its employees as healthcare heroes. Do you feel treated like a healthcare hero?
No.
Share a little bit more about that.
Well, for one, I see a lot of donations on my floor for like food, just stuff to appreciate the staff that's been working overtime and doing their best to keep the hospital going, and at the rate of what's been going on. We have not been acknowledged on that floor as housekeepers or keeping things together. Nothing, not even a thank you. So it's like I feel like a slap in the face that me and my child been going through this.
Yeah. I'm sorry. I'm really sorry. And you're in the hospital with him right now?
Yes.
Wow. That must be incredibly hard for you. And I just want to share that it's important for you to share your story, both with the press and with other workers, because we know how hard it is for you to apply for workman's comp, and it should be easy, right?
Right.
Okay. All right. Anything else, Lagwina, that you want folks to know about how it's been with you in terms of your situation?
No, nothing else.
Okay. What do you want Northwestern to do?
Well, we should get our pay. We should be treated fairly like the nurses, the doctors, everyone else, not put in the category as, oh, that's environment service. Oh, well. So that's pretty much it.
All right. Thank you so much.
Mm-hmm.
Our next employee is going to be Candace Martinez. Candace Martinez, if you'd like to introduce yourself and your role at Northwestern.
Hi, my name is Candace. I work for EBS. I work on labor and delivery, and I clean the rooms on labor and delivery.
Okay. And can you share your story about how you tested positive for COVID-19?
Yeah. I started feeling, on March 20th, I knew I was coming down with something after experiencing some symptoms for that past week. And on the 26th, I was so basically I was at work up into the 15th of April. And when I went back to work, a few hours into my shift, I started having chest pains. I went to the emergency room and have been off of work since then.
And how have you been receiving a paycheck during this time?
I haven't. While I was sick, luckily I had paychecks from, when I had been working. They loaned us 80 hours of sick time, basically saying that we have to pay it back. But after the 80 hours, like this week, I haven't received nothing. Okay. I don't have no income.
All right. And have you applied for workman's comp at Northwestern?
Yes, I did. After getting the runaround all of March while I was sick, I was on, I forgot what, it was over 2 weeks ago. finally got somebody at the job to fill out um
An employee
finally,
incident
I'm
report?
sorry, yeah, I finally got somebody to fill out an incident report, and when I called it was hard to get hold of somebody after that to see what was going on, and when I did get hold of somebody in the workers' comp at the hospital, they asked me a few questions, and when I was trying to ask her questions, she basically wasn't giving me direct answers, and that's the last time I heard anything about my case. And I've called and I've left messages, and at this point I've heard through my, just through some research that, well, I haven't heard anything, but I'm taking a guess that I was denied, because it seems like this is from these conferences. This is when the information is,
Yeah.
but nobody's called me.
And since you've been out, what impact of having no income has that had on you and your family?
I can't pay my bills. I'm empty-handed right now, and I'm trying to figure out how to go about it. I can't pay my rent. I can't pay my son's tuition. I can't pay my phone bill.
Okay.
I don't know what
And
else to do at this point.
And so Northwestern, again, one of the wealthiest hospitals in the state, what do you think they should be doing for you right now?
I think that they should be giving me my workers' comp. I mean, we as EVS, and us just speaking as my department, they ask a lot of us, and they always, it, want more from us. And so when it comes time when we need help, or when we're sick, or when they don't care, they don't care at all. Did you think anybody checked up on me while I was sick from the hospital? No. Union did, but not the actual hospital. So.
All right. Thank you, Candace, for sharing. Again, it's, incredibly angering that Northwestern has let its employees go without a paycheck, let them out to dry, not followed up, not ensured your safety, when despite being very clear that these are, hospital related infections. Next, I'm going to move over to Dominique. If you'd like to introduce yourself and what you do at Northwestern.
How y'all doing? My name is Dominique Golfin. I work in CSS at Northwestern, but I work in the 259 building. So my building was closed, and I've been working in materials for the last few weeks.
Okay. And Dominique, last week, the hospital and the union reached an agreement that would provide workers hazard pay who are coming into the hospital, working and doing their jobs. And when you found out about this, how did your supervisor relay this information to you?
My supervisor never relayed the information to me. My supervisor, management, none of them. I got an email from the union stating that we reached an agreement with the hospital that they were supposed to be giving $3 to the workers and $5 for the workers that were on like COVID units.
Mm-hmm. And did you see this money on your check, which you would be getting tomorrow?
Not at all. No, I check my check every Wednesday before I get paid, and it's not on there.
Yeah. So Dominique, tell me a little bit about the job that you do. What is CSS?
Oh, well, I work in sterile processing CSS. What we do is we clean the instruments for the operating room for the surgeons and the nurses to perform surgeries on the patients.
Mm-hmm. And these are instruments that have come from rooms that have had positive COVID patients?
Yes, ma'am, of course. Any surgery that goes on, the instruments come through us. Any surgeries that go on with any patient, it comes to us, and we have to clean them and process them and put them in a sterilizer so that they can be used for the next patient.
Yeah. And, the hospital explained to the union that anyone who worked inside the hospital would be receiving, not in an office building, not in, an outpatient clinic, but anyone who works out in the hospital would be receiving this $3 hazard pay, and yet you're being told you're not receiving it?
Not receiving it at all. Check my check last night.
And Dominique, when you arrive at work, you enter the same door that everyone else enters, and tell folks a little bit about that process, right? When you come to work.
Well, we walk in and they take our temperature and they ask us how we feeling, and they give us a mask that's basically worthless. The mask doesn't even fit your face the right way. I might as well put a paper towel on my face, and then we go on about our business. They send us to work.
So you're entering the same door as everyone else. You're around the same employees who work the COVID floors. You're taking your temperature the same as anyone else, correct?
Yeah, I sometimes we have like different. Yeah, I go through the same doors as everybody else.
Okay. And how did it make you feel when you have been coming to work and yet when you looked at your check, you didn't see any of the hazard pay on there?
Oh, it was frustrating. You know, we come and we leave our homes. It's a stay-at-home order, and we leave our homes to come to work 5 days a week for me. And I have a child. I have a family that I got to take care of. So I'm forced to come to work. I got to come to work because they won't pay us if we don't. So I get there and they say they're going to give us hazard pay for us, doing this, this hero duty, and we ain't getting it. So it's just empty promises.
It's frustrating, to say the least. Do you think is this a situation where Northwestern can't afford to pay it?
Northwestern probably got. Yeah, Northwestern is probably. I think we number one in Chicago, number one in Illinois. So I'm sure they got the money. If the CEO, they put his. I seen his pay. He made. If they just cut out on their bonuses and everything like that, I'm sure they could pay us easily, even with all of the profits that Northwestern make. They could give us something to help us out, considering we're in the middle of a pandemic.
Yep. All right. Thank you, Dominique.
All
right. I got kicked off. So if someone could message me, is it Everett on? No. Okay. All right. I am going to turn it over to Senator Peters now. Senator Peters is the senator who represents the geographical area that Northwestern and several other healthcare facilities are in. Thank you so much for joining us today, Senator Peters.
Definitely. Thank you. Thank you, LaGuana, Candace, Dominique. Let me just first start off by saying that I have a unique relationship with Northwestern Hospital. I talk about it a lot. When my dad had cancer, he passed away at Northwestern. He went there to get the help and care that he needed. I remember when I demanded that an ambulance take him to Northwestern because that's how good Northwestern was to him and my family. And I think what makes Northwestern so special isn't that it's just a building, but it's filled with amazing, beautiful, hardworking, and loving people like the folks that we've heard here. My relationship with workers there is that they do the care for all of us. They do this work, and it is our job, especially my job as a state senator, to lift them up. And I think when we think about essential workers, we have to look at the race, gender, and class connections here and the historical significance of this fight. This isn't something that just came out of nowhere. The relationship between the people who do this work has been at tension for as long as I've been alive. And I think what we're in now is a sort of a new consensus. It's not enough for people to say that we appreciate you, or we want to clap for you, or we want to, give you some great meme on social media. It's not enough. There is a new consensus, and it's time for us to move beyond kind words, but to actions. This means everyone needs PPE. Everyone needs hazard pay. Everyone needs the support and love and dignity. It is not enough to be a charity. It's not enough just to be kindness. This is about respect and justice. This is about power and who has it. So I think we need to move from the pretty pictures on social media and the pretty words that are said to giving folks that we have heard on this call the love and care and the PPE and the hazard pay they deserve. Northwestern is a large institution. So I go back. It is Northwestern Hospital. It is the workers there that made the experience with my dad so special as he passed away years ago. And when we think about these institutions, they need to be bigger than just those at the top. In order for that institution to be strong, everyone must be strong. So I stand in solidarity with the workers here. I believe that we are entering a new period, and that period is to make sure that everyone is lifted up, that nobody's pushed down, and that we see this as a public health fight. That if one of us isn't healthy, then none of us are healthy. So thank you for having me. I'm glad to stand in solidarity. And I think if we can organize and we fight, we win.
Thank you so much, Senator Peters. I am now gonna talk with Everett Oliver. Everett Oliver is a patient care tech at Northwestern and share a little bit about the changes in protocol that he is experiencing on these floors. Everett, if you could introduce yourself and share a little bit about your role at Northwestern.
It's *6 to unmute, or the button in your left-hand corner.
Everett, if you could press *6 to unmute.
I don't think he's on.
No, he's on. I see him. All right.
Okay.
Okay.
All right.
Can you hear
Okay,
me?
Everett, if you could just introduce yourself and share a little bit about your role as a PCT.
All right. Hi, good afternoon. My name's Everett Oliver. I'm a patient care tech at Northwestern Memorial Hospital. Sorry I came on late. I worked last night and overslept. I'm in the float pool, so I'm all over the hospital. And once these changes occurred with COVID-19, we weren't really notified of it. Kind of just found out by word of mouth, and we are well, I've been assigned to do like EKGs throughout the hospital, so wherever the EKG is needed, I go. And on some of these COVID floors, well, recently, because of the PPE, they're constantly changing the PPE protocol. Unless it's aerosol generating, they want you to go in there with just a surgical mask. And I have to refuse to go in there unless they give me an N95. Because, you know, I have a family, I have a wife and kids. Kids, both asthma prone, wife asthma prone. So I have to make sure that, you know, their safety comes first.
So I want to clarify that, Everett, these are patients who previously you were instructed you needed to have an N95 if you were in close contact with the patient, and now they're telling you you no longer need to wear an N95 with these patients?
Correct. COVID positive patients, they said you're still okay to wear a surgical mask as long as they're not doing any aerosol generating procedures such as breathing treatments. And yeah, I refuse to go in there without a N95.
When
regardless of whatever.
When nurses and doctor go into the room to be with the patient, are they provided a surgical mask or are they wearing an N95?
Oh no, they got N95.
Yeah. Okay. And Everett, do you just want to share a little bit about your experience in attempting to get tested by Northwestern?
So yeah, I've had symptoms twice. When the COVID-19 like when they start changing things around the hospital due to COVID-19, they would monitor you by you signing a piece of paper on a COVID patient. They would have that paper on a COVID patient's room, and when you sign it, that's considered like you were exposed to the patient. So you would have to fill out an online survey twice a day for 14 days. And when I had symptoms and indicated that on the online survey, they told me to stay home and self-monitor myself. But they didn't provide a test. They didn't ask me or tell me to get tested. And me being worried, I had to go to a Walmart testing center, 4 hours in line in my car, just for the test. And then most recently, 2 weeks ago, I had symptoms, and they changed protocols throughout the hospital. They were testing everybody, not testing for COVID, but they were questioning everybody. When you walked in the door, they check your temperature, ask if you had symptoms. And I had symptoms. They told me to stay home. And then they sent me to get a test like 4 days later. And then after I got tested, they told me I had to stay home until I was symptom-free for 72 hours, not 24. So I ended up missing almost 9 days just from symptoms that came out of my sick time, not
And when you miss those 9 days, yeah. So you were told to stay home by the hospital as a result of having symptoms, and you used your own PPR. Yeah.
Yep.
All right. So again, what do you feel like Northwestern should be doing in this situation?
Well, I feel like at times they are putting things in place kind of to cover their own butt, but not really looking out for the welfare of, the workers. Well, at least not the shining star type workers, not the doctors and nurses. They look out for them, but for the people behind the scenes and that do the grunt work, they're not really looking out for us.
And Everett, how long have you worked at Northwestern?
August makes 11 years.
All right. Thank you so much, Everett. I'm now going to open it up if there are questions from the press.
Yeah, if there's any questions, feel free to unmute yourself or type a question in the chat box. *6 to unmute on your phones and on your computers in the far left bottom corner, left-hand corner.
All right, seeing no questions, thank you everyone who shared their stories today. Thank you, Senator Peters, for your continual support on this issue. We think it's important for workers to be recognized for their work that they are doing, and the best way for an employer to recognize the heroic work of our members at Northwestern Hospital is to properly pay them and properly protect them, give them access to PPE, give them access to testing, and pay them the appropriate hazard pay. Thank you so much again for joining us today. Any follow-up questions, feel free to contact our press contact. Thank you.